I'm really privileged to be here with all of you today at the first ever Western Mass Equity Summit, and I'm sure it will not be the last. And I am here also to not only talk with you, but to listen and to learn from all of you. PolicyLink is a research and action institute that advances social and economic equity by lifting up what works. But we believe in all of our work that our local leaders, like you, are our nation's leaders. And so the lifting up what work is really about listening and hearing from you of your wisdom and your insight and experience and telling us what is working and what isn't working as it relates to advancing equity in regions. So I'm really looking forward to this conversation today. So we've done a bit of some definitions, but I wanted to share with you the definition of PolicyLink around equity, which is just and fair inclusion. And the goals of equity is really to remove barriers and create conditions in communities that allow all to prosper and thrive. And equity also means that ensuring that those voices that have been shut out are at the center of conversation and are really leading and shaping solutions for our future. So why is equity so important? And what is the urgency and what's the opportunity? Well, we know that the face of America is changing. This was what the United States looked like in 1980 as it relates to regions that had more than 50% people of color. This is 1990, 2000, 2010, 2020, 2040, 2040. So as you see, in 2040, we will have the people of color will be the majority in this country. By 2019, the majority of children under 18 will be children of color, and by 2030, the majority of young workers in this country will be people of color. And we also know and see the data that communities of color are driving the growth in Massachusetts. So in Massachusetts, while the overall population growth has really not grown and has been relatively stagnant, the rapidly increasing population of Latinos and Asians has risen quite exponentially. Between 2000 and 2010, Asian Americans were the state's fastest growing population. And at the same time, Hispanic Latino population grew by almost 50% at a rate 15 times greater than the state's population as a whole. So I'm pulled up just some data to show what the population growth has been in Western Massachusetts and Central Massachusetts. So you see here in Hamden, predominant Latino and Asian, very similar to what's happening across the nation. Here you see Franklin, an overwhelming growth in the Latino population. Here's Hampshire, equally across African American, Asian, and Latino. Worcester, which I was told is not technically considered Western Mass, so I was corrected. But I included anyway, and I will say it is Central Mass. And then here, specifically in Springfield, you see a huge growth also of Latino and Asian population. So I bring this up to raise the question, and I hope that over the course of the day we raise a lot of questions and this sparks really good thought and ideas. But the question being, how are we going to step into this future and not shy away from it? How do we need to do work differently? How do we need to make investments in a different way that will ensure that the future of Western Massachusetts will succeed and thrive? So we also know that place matters and that where you live is a proxy for opportunity. And the provost just said it perfectly when she said that we are seeing increasing levels of racial and income segregation across the country. And that level of segregation is really causing a whole host of problems in our communities. from escalating rates of chronic disease to crime rates to dropout rates, and also increasing concentration of lack of access to opportunity. So the way that PolicyLink has been defining an equitable region is really around three factors. One is to ensure that everyone is able to participate in the region's economic vitality. So ensuring that everyone has a high quality job, and also that are allowed to really be able to spur business and ideas around economic activity to ensure that the region is competitive. The second is to ensure that the region is ready for the future with a skilled workforce and a healthy population. And then the third is around places of connection, to ensure that not only residents can access the key ingredients to living healthy lives within their neighborhoods, but also being able to easily connect to other opportunities within the region and across the state, and more importantly, through transportation and other resources. So I want to break down a little bit about what does equity look like? And there's two ways that I talk about equity. One is equity through the process of planning and implementation, and the other is equity through policy change. So let's start with the process piece. Well, we've already seen some data, and data collection analysis is so important to really understanding the full equity context of a region. What is the state of equity in your region? And I have to just give major kudos to the authors of the report, the Springfield Health Equity Report. They've just done a wonderful job in really laying out the full picture of equity in the region. So kudos to you. I also wanted to essentially bring up two fundamental questions around data collection analysis, which is to answer the question around not only who is experiencing the inequities, but where are the places that are experiencing the deepest inequities. And this really requires a much more sophisticated analysis that really disaggregates data by race and by income to really see how this is playing out across different populations. So PolicyLink, along with the Program for Environmental and Regional Equity at USC, have been developing over the past couple of years what we call equity profiles. And they're 100+ page profiles of regions, selected regions across the country, where we look at the state of equity in that particular region. And what we've been doing is really developing these profiles to help to inform planning and decision making from a regional perspective to really be responsive to the demographic shifts that are happening in your communities. And the way that we've laid out the indicators framework for these profiles are four-pronged. One is to look at the demographics. So again, population growth, who lives in your region, and how is this changing? The second is economic vitality, as I just mentioned. The readiness, really stepping into the future, and connectivity. And I will just mention that, fingers crossed, at the end of this month, PolicyLink will actually be launching our public website that's an equity atlas where you will be able to create your own maps and data and your own equity profiles very similar to ones that we've created. And this database includes over 120 indicators, health, non-health, and across the board. So we're really excited about that. Now, just to add to what's in the Springfield report and give a little bit more of a context around equity, one particular indicator that we look at is not so much the degrees, high school degrees, but really associate's degrees. And the reason for that is that we're seeing that the jobs of the future are going to require an associate's degree or more. And so when we think about the future, we wanted to look at, well, what's the state of equity now? And overall, as you see across the country, people of color are least likely to have an associate's degree. Now in Springfield, it's also pretty similar. And so again, the question becomes, what types of pipelines and workforce development opportunities will we create to ensure that people now will be able to access the jobs that will be the future jobs for this region. Now, another important social determinant of health is transportation. And we look at, one indicator is likeliness to own a car. And so you see that predominantly households of color are more likely not to own cars, so have a huge dependency on public transportation, and accessing public transit is really key to connecting people to opportunity. Now, the last indicator I will lift up here is disconnected youth. Disconnected youth is looking at youth between the ages of 16 to 24 that neither have a job nor are in school. And in Springfield, you see that there's overwhelmingly a good share of Black and Latino youth that have no access to a job or are in the pipeline for a degree that will set them up for success to thrive. Now, another component of data, which we often don't really think about, but I think is equally important when we talk about equity, is really understanding the systems that we play in, the systems that we work in, and how they're either promoting equity or how they're hindering us or undermining equity. So this is a slide I like to use to really think about and begin to question, how do we as institutions, as organizations, as universities, hospitals, how do we operate? And is that really in a way that will further equity? So for example, you can look at data conflicts. So many times we talk about, well, different people are collecting different data points and we're never sharing data. So how do we think about ways to really align data? Where are there gaps in the data that we need to really address? There may also be issues around relationships across institutions, and more importantly, relationships with communities that are most impacted by inequities. What's been the history of your institution in your community? How do we try to build trust again and change relationships in a way where there's real meaningful engagement and participation of the communities at the table? And then structurally, there's so many issues, from the way that departments are created, how people communicate internally, and one particular piece that people may not really think about are budgets and budget priorities. Budgets are one of the most powerful tools to really create major change around equity, and it's also a way to help to hinder it. And so really looking at grant making and budgets is really important to think about, how are you strategically targeting your resources in a way that will really be laser focused on equity. So now I want to move into engagement and leadership, because this is another critical component to advancing equity. And just to acknowledge that in order for us to really undo the patterns of discrimination and marginalization, we've got to bring and reach out and engage communities of color and low-income people. And it's not just about inviting them to participate, it's allowing them to lead the solutions, to help in shaping the solutions and having a voice to those decisions. So it really requires us to create a process that has three elements to it. One is that it's inclusive, so that we make sure that we're really allowing all people to come to the table. Two is that it's accessible. Where are we holding meetings? Across the state, in different communities, in the evening, during the day, allowing everyone to come. And I think most importantly, transparency. I have seen time and time again where coalitions really come together, and what starts unraveling is that when there's a real lack of communication and transparency around what are the expectations, what are the roles, what are the specific responsibilities that people have, how are we going to hold ourselves accountable to communities and be able to follow up and really bringing them along in the process. So this is a ladder that we created several years ago that really shows the opportunities for engaging community residents. And at the very bottom, you'll see that there are town hall meetings and focus groups. And I know we love our town hall meetings and our focus groups. And they are valuable, but they are one-shot deals. and they're a way to get input from the community, but there's no long-lasting way to continue the dialogue. So as you move up to the ladder, you see at the very top the governance level, where you have actually people appointed to governing boards. And that is where the real shift happens in how we advance equity, to ensure that people of color, low-income people are at the table making these decisions and are in these positions on governing boards to institutionalize that change. So I want to share an example with you, and this actually comes out of Urban Habitat. It's their Boards and Commissions Leadership Institute. And I think now they've gone through 4 cohorts. It's about a 4-year program. And it does 2 things. One is it's a year-long advocacy training where it brings residents from low-income communities and communities of color to join an advocacy training. But then once they graduate, Urban Habitat also created what's called a Seats First approach. They created an inventory of all local boards, commissions, task force, councils, and the minute that a seat opens up, an e-blast goes out to their graduates to send in their nominations and applications for that seat. And over the course of time, graduates from this program have not only won seats on governing boards, but a few of them have actually run for office and have won. So that's real change, and that's real shift in power of really being able to reflect the demographic shifts that we're seeing and being able to have those voices in decision-making spaces. So now let's move into talking about equity through policy change. So we hear a lot about health in all policies, and I also want to lift up the importance of equity in all policies, that we think about policy change in a way that we ask ourselves, are we producing positive impacts or negative impacts on low-income people and people of color? And one way to think about how you really advance health and equity in all policies is to think about, are these going to get me to the triple bottom line? And the triple bottom line meaning it improves the health of people, it is revitalizing neighborhoods or place, and it's creating good jobs and real focus on the economy. So again, thinking about your strategies moving forward in conversation today, where are there strategies that you can have multiple benefits and hit on multiple prongs? So here's a very short list and a menu of all the different types of policy and environmental changes that we've seen over the past years as it relates to physical activity, the built environment, and access to healthy food. And in and of themselves, these policies will not advance equity. So equity doesn't happen by accident. There must be intentionality and deliberateness in ensuring that there are equity components to that policy change that will ensure that we actually reach our outcomes. And I thought it was great to give the shoe metaphor, because that's exactly what is meant in this real practice, is that not all these policies as is fit in a community. And therefore, our job is to determine what size does this community need and make sure that the shoe does fit. And I'll give just a couple examples of that. So one example is the Safe Routes to School, as I'm sure many of you are familiar with. It's a national program, valuable program that's really encouraging walking to school and physical activity. Well, in rural communities, Safe Routes to School as is doesn't necessarily work. So you'll see in rural communities where they've modified it that it's not walking to school because there's so many miles to walk, and it's not particularly safe at times, but it's walking to the bus stop that will then get them to the bus to go to school. So that's the fit. Another fit is having an approach like this implemented in the South. Now, in 2 states, in North Carolina and Tennessee, there were attempts to and plans to bring this forth and encourage the idea of neighborhood schools and walking to neighborhood schools. But essentially what was happening was that it was promoting resegregation of schools and communities, because the areas, the communities were so segregated in the South. And it was going against policies to promote integration and really busing policies. So there were actually a couple lawsuits that were brought forth by NAACP to really challenge this idea of, does this policy change fit in this community, and what are the unintended negative consequences that that are being created as a result of not really thinking through, does this fit? So equitable policies mean really four things: that equity must be included as a criteria by which to prioritize or include any type of strategy in your plan, that the policy itself is important to low-income people and people of color, and that it targets resources to places and people that need it the most, and that the benefits are prioritized to those communities. So I think as we continue to talk about equity in policy and building healthy communities, we must also acknowledge gentrification. And I raise this because Ben Wood brought up this question. Last week, I was in Boston at the Massachusetts Partnership for Health Promotion and Chronic Disease Prevention Summit. And Ben raised this question around gentrification and equity. And I think it's an important one to raise here, because as we think about building healthy communities, and gentrification is a public health issue, and it can be prevented if we actually take the deliberate steps from the onset. And to acknowledge that, gentrification, our history of it has been that we've put policies and practices in place that have had long and deep negative impacts on low-income people and people of color. So really, when we think about gentrification and moving forward into our future, to think about investments and efforts in a way that, again, increases jobs and business opportunities for the local residents, to create measures that will ensure affordability for everyone, and also these value capture measures, meaning that to ensure that the wealth that is generated within those investments are actually staying in the community and not going out. And I wanted to just lift up and you see a small icon there. It's actually a report that just came out from Just Cause and the Alameda Health Department called Development Without Displacement. It's a pretty thick report, and it's excellent. And I would strongly encourage all of you to Google that report and dive in a little bit deeper to what it means to do economic development without displacement. So I wanted to just then move into what does this look like, and what are some promising models that we've seen across the country? Well, one is the Healthy Food Financing Initiative, the national program that was modeled after the Pennsylvania Fresh Food Financing Initiative, which is a public-private partnership that is providing loans and grants and financing to incentivize the retail development in low-income communities and communities of color. And in Philadelphia, there was huge success as it relates to, again, the triple bottom line: improving health, creating jobs, and revitalizing neighborhoods. And I would even add a fourth, which is to say that now they've added a fourth component to really think about energy efficiency, and looking to creating green jobs and how to retrofit grocery stores, corner stores, other places to be able to then bring the environment piece to it. Now, as the provost said earlier, anchor institutions are critical regional economic creators. And this is, I think, a really important topic for us to consider as we go through the day. They are major employers, they have significant amount of land, and they spend millions of dollars on goods and services. And as of, I believe in a report in 2012, the estimate was that anchor institutions procure more than $1 trillion of services a year, but very little are spent locally. So the question becomes, as an anchor institution, how do we ensure that we're building wealth, that we're putting back into the community, and that they're part of that wealth-building, economic driving force? So Green City Growers in Cleveland exemplifies how anchor institutions have come about and orienting their spending power in a way that is really focused on divested communities and bringing together good jobs and wealth building. And particularly what this has done is launched an employee-owned 3 green businesses: the Cooperative Laundry, the Energy Solutions, which provides energy services, and the Green City Growers Cooperative, which is a hydroponic green farm that is raising lettuce and basil. And these are just 3 businesses, and they're looking to create 10 in the region. So it's created dozens of jobs, and we will see many more. And in particular, it has brought in opportunities for those that have prior felony records. Over half of those that were hired have prior felony records. As I had mentioned before, transportation is not only a health issue, it's an equity issue, and I would say it's a civil rights issue. Dr. King recognized the importance of transportation both as how it connects, but also dissects communities. And in 1969, he said that urban transit systems have become a genuine civil rights issue. Well, now 50 years later, I think transportation can still be considered a key civil rights issue. So one example of this is a very recent, I think 5 months ago, landmark victory in Milwaukee, where the Black Health Coalition of Wisconsin and also the Milwaukee Inner City Congressional Allied for Hope, MICA, 2 grassroots coalitions and organizations, brought a lawsuit to the Wisconsin and U.S. Departments of Transportation to create mass transit opportunities for the state, but in particular by carving out a set amount of dollars to be spent to expand and create bus routes from the center core of Milwaukee to the outlying suburbs. And they brought together this lawsuit together in a way that will really bring some real change regionally and connect people at a regional level. And one, I think, important note to make here is that, while I would say that lawsuits are probably not the first strategy I would say to go to if you want to advocate for policy change, it is definitely a very powerful tool to use in advocating for change. So a more local example I wanted to provide is the Greater Worcester Community Health Improvement Plan, which just recently came out. The hospitals and the clinics and other 40, I think, local organizations came together to not only do the community health needs assessment, but then develop the CHIP. And what's so promising and important about this example is that they had a real extensive and substantive community engagement process, where ultimately they reached out and engaged about 1,800 residents and partners as part of the process in developing the plan. And because of that community engagement process, they came out with 5 domains in their CHIP. But I want to lift up one specifically, which is the health equity and health disparities domain. And I wanted to read what that priority states. It is to improve population health by systematically eliminating institutional racism and the pathology of oppression and discrimination by promoting equitable access to and use of health-promoting resources in the community and significantly reducing the structural and environmental factors that contribute to health disparities. I would say that's pretty powerful language to put into your health improvement plan. And it's the first of its kind. And just to have that on paper is a huge step to ensuring that you are on the path to achieving equity. And then be able to really then hold yourselves accountable to saying, are we putting in place the approaches that we need to make sure that we're fulfilling on that priority? So I just want to end with a few last takeaways before we go into questions and answers in our panel. And one is that, over time, I spent my formative years in Boston and Worcester, and my public health years here, and this is where my journey, both personally and professionally on equity started. And I come back every so often, every year, and I'm just amazed at all of the incredible work that's underway. And I'm also seeing that while time continues, there's still some challenges that I see. And I hope that we can really begin to have a conversation about that today, which is the idea of bridge building. Bridging between sectors and fields, bridging between institutions and communities, bridging across the state, and really being able to bring together connections that are between Western Mass and Central Mass and Eastern Mass. And also equally so that we're serving as silo buster superwomen, where we are really thinking through what silos are we creating and how do we bust through them. Because the way that this plays out in communities is not by silos. If you look at those communities that have the deepest inequities, they are across the board. And so our approaches really need to be across the board and more integrated. This idea of the triple bottom line, think about ways that your strategies can really sow through that intersection of people, place, and the economy. So begin to weave together your strategies. There's a lot of innovation out there, and there's a lot more to be done. This is really the place where we really should be thinking about what are some promising practices that we can test out that will really ensure that we're advancing equity. And it may look, as you see in the pots, very different in different communities. But equally important, we should look at what is currently happening now and refine it. Where are there gaps? Are we really addressing equity? How can we better address equity and really adjust it so that the shoe fits? In this idea of intrusion and deliberateness, intrusion, I think, seems very negative. But as I looked into other synonyms of this word, I found introduce, chisel in, and hold up. And that's really what this work is about, to ensuring that equity, that we introduce equity into our conversations and our dialogue, that we chisel it in a way that will make meaningful impact, and we hold it up and hold ourselves and each other in ways that will be accountable to that. And so that requires behavior change. And it requires us to think about how we act, how we engage, how we work, and how we need to do that differently. So all this to say that it takes time, and it's not easy, and it's not always clean, but it's worth it. And we can no longer be tone deaf to what is happening in our communities and to not really think and step into our future that you will see in Western Mass. And last, to say that, equity is not about the specific issue. I know all of you come from very diverse perspectives, work on very different issues. The idea here is to use the tactics and the processes in a way that will ensure that those that have been left behind are central to moving the work forward. So with that, I just want to say thank you so much. I'm really looking forward to hearing from all of you, and I'm not sure if we have time for questions. Okay, great. So thank you so much.